Absolutely. Welcome everyone to a special lecture series through the Injury Control Cobra at Rhode Island Hospital and offered through the Research to Practice and Policy Core. I am delighted today that we are joined by two esteemed researchers from the Centers for Disease Control and Prevention. First, we're joined by Lindsey Barranco, behavioral scientist, and also a scholar within the Prevention Practice and Translation branch of the Division of Violence Prevention at the National Center for Injury Prevention and Control of the Centers for Disease Control and Prevention. Dr. Barranco has worked widely across several domains of public health practice and research, including work addressing childhood adversity, homelessness, and violence prevention. Dr. Barranco also recently published the article Moving Evidence to Action, a strategy to support the implementation of violence prevention efforts in health promotion and practice. Dr. Barranco is also the featured speaker at the 2022 Society for Prevention Research Conference, which focused on realizing the power of prevention through equitable dissemination and implementation science. She gave the presidential address entitled Moving Evidence to Action, Developing Resources to Support Implementation of Comprehensive Violence Prevention Efforts. Her work has also been essential in advancing dissemination and implementation science throughout the Centers for Disease Control and Prevention. So we're delighted to have her join us here today. I'm also delighted to introduce Dr. Lianne Estefan, a lead behavioral scientist at the Centers for Disease Control and Prevention within the Research and Evaluation branch of the Division of Violence Prevention. Dr. Estefan is a highly published scholar in the area of violence prevention and response. She's an author of the work entitled Enhancing the National Dialogue on the Prevention of Intimate Partner Violence, which focuses on the way that the Centers for Disease Control and Prevention's Delta Focus program engages state domestic violence coalitions to implement IPV primary prevention. She's also a leading contributor to the Dating Matters Intervention, a comprehensive teen dating violence prevention model that includes multiple coordinated prevention strategies across the social ecology. She's published extensively on the efficacy of violence prevention efforts and also on the role of ideological evaluation and implementation research in the prevention of violence. I'm delighted that Dr. Estefan is here today to also share her knowledge with us. The title of the talk is A Framework for Implementation Science within CDC's Division of Violence Prevention, Advancing and Integrating Work Across Public Health Functions. Dr. Barranco and Estefan, I'll let you take it from here. Thank you so much again for being here with us.
All right. You want me to kick us off, Lianne, or you want to?
Yeah, something is beeping in my office and I'm not sure what it is. I'm just trying, of course, it just started right now. Do you want to do like the first few slides and then I'll pick up? I'm so sorry.
No problem at all. It's one of those things and we're working from home. All right, thanks so much. And thanks for such a wonderful welcome, Lindsey. I did not expect that. So thanks so much. This is just our obligatory disclaimer slide that we have to put on everything. So we're hoping today to share a little bit about the ways that we are trying to implement or apply implementation science to support implementation and dissemination of evidence-informed programs, practices, and policies with you. Lianne will share a little bit of background about the Division of Violence Prevention for those of you that aren't familiar with us. And then she's going to share about how we approach implementation research, particularly around building the evidence around violence prevention. And then I'll talk a little bit about some of the tools that we've developed for supporting both selection, implementation, adaptation, and evaluation of evidence-informed programs. So hopefully it'll be helpful. We'll hear from, Lianne, who really focuses more on the research side, and I focus a little more on the practice side. So we work together to really kind of bring all those pieces together. Lianne, you want me to keep going?
Can you hear me?
Yep, I can hear you.
Okay. My computer does not, my camera doesn't seem to be working, but at least my computer stopped making that horrible noise. So if you can hear me, I'll start. And then if it happens again, we'll go from there. I'm so sorry.
No,
thanks, Lindsey, for that. So we wanted to start before we jump into our implementation science work to just give a little bit of background on what we do in the Division of Violence Prevention. and who DVP is and what we do. So we know that violence occurs across the lifespan and impacts millions of children, youth, and adults each year. Next slide. And we also know from research that violence has a lasting impact on a wide range of health and health outcomes and opportunities. And these range from injury, mental health, maternal health, both infectious and chronic disease, risky behaviors, and educational, income, and occupational opportunities. Next slide. But we also know that violence is not inevitable. Decades of research really have shown us that violence is preventable. And we also have learned that a comprehensive approach targeting multiple risk and protective factors across the social ecology is critical to having a broad and sustained impact on violence. And because we're going to be talking about it a lot in this presentation, in case you're not familiar with social ecology, it's the interplay between individual, relationship, community, and societal factors that really have a large role in all the work that we do. So here, just briefly, are some of the highlights from our DVP's 5-year strategic vision, where we really envision a violence-free society in which all people and communities are safe, healthy, and thriving. And we do that in a variety of ways, including providing leadership and building bridges across sectors to use data and conduct research. We identify, evaluate, and apply solutions for preventing violence. And we focus all of our efforts really on those at greatest risk for violence. And then DVP brings together partners and connects data, science, and action to inform the development, implementation, and sustainability of violence prevention strategies that are proven to be effective. And some of the ways we do that are shared on the left side of the screen, including monitoring behaviors, injuries, and deaths, conducting research, creating and evaluating the effectiveness of programs, practices, and policies, working with local and state partners, and promoting the effective adoption and dissemination of violence prevention efforts. And today we're going to touch on a little bit how implementation science is really woven into most of these areas of our work. Next slide. And so for nearly 40 years, DVP has utilized and shared the best available evidence and conducted research to identify what works to prevent a variety of forms of violence. However, within the division, we're always really striving to strengthen our implementation science work, because as I just mentioned, it's really an important component of moving us toward achieving those goals and doing the work that I talked about on the last slide. And so to that end, in 2019, we started an implementation science work group within the division. And what's shown on this slide are some of the areas that we've focused on, including developing an implementation science agenda for our work within the division, and also really working to establish and integrate implementation science throughout all of our work in our portfolio. Most recently, our work group has been taking concrete steps to advance implementation science across all of the division. Next slide. And so as part of this, we've really spent a lot of time unpacking the idea of implementation science and how we can apply it within the division in really sort of 4 main ways. But first, I want to call your attention to this slide on the left is the definition of implementation science that we use. We sort of, as a work group, put this together from various sources, and it's long, so I'm going to read it to you. But it's the creation, adoption, use, support, and integration of the best available evidence on programs, practices, and policies in real-world settings, including research, program evaluation, and dissemination. And so in the figure on the right that we've developed, you can see how implementation science is related to those component parts or buckets, implementation research and program evaluation on the left, and then knowledge translation and implementation practice support as sort of 2 components of dissemination on the right. And this isn't really meant to be a new framework, because we know that there are lots of implementation science frameworks that already exist, but it draws on them. And we developed the graphic to help all of our staff see how implementation science can influence the work that they do and create sort of a common language and understanding around the division. So we're going to walk through these 4 areas of implementation science in the rest of the presentation and how they are incorporated in our work today. And I think one thing that we both want to think through and call your attention to is that these aren't 4 individual areas under the larger umbrella of implementation science. Each area is really connected to each other. And that's why there are those arrows in the figure to really show how all of these things work together to be parts of implementation science. Next slide. So I'm going to talk about implementation research and then turn it over to Lindsey to talk about the other parts. The definition that we use in DVP is that implementation research is the systematic study of factors that influence effective implementation of public health programs, practices, and policies to provide generalizable knowledge and implementation innovations to improve public health outcomes. Next slide. And so here in DVP, we have a number of implementation research activities, including conducting research intramurally, funding the research and evaluation of practice-based programs extramurally. We've begun to integrate implementation research language into our funding opportunities and guiding documents, and then disseminating results with our partners in a number of different ways. Next slide. A few years ago, we did an internal scan of the types of implementation research and we do in the division, and there's some broad categories here of the things that we found, including field-based research and evaluation of specific interventions that are already being implemented in the field. We also do some research around implementation factors that are related to community and societal level primary prevention, which is our focus, and then research on adaptations in new populations or settings, which is particularly important given focus on health equity that we really have. Next slide. And so what I'm going to do is give a couple quick examples of how implementation research is woven into some of our larger research and evaluation initiatives. So the first is through our rape prevention and education, or RPE projects. And the background, just briefly on what these are, if you're not familiar, is these research projects work to expand the evidence base for sexual violence prevention and focus on promising practice-based approaches that are already working or being implemented in the field. We've funded projects both in 2016 and 2020. And something that is particularly unique and important about these is that they involve collaborations between academic researchers and RPE funded organizations to advance the field of SV prevention. And so here are some broad areas of the way implementation research works in these funded projects. Again, the overall sort of purpose is to evaluate the outcomes, but within that, we're able to conduct some implementation research, including understanding adaptations and the implementation itself, implementation related factors of evidence-informed practices that are being examined, and also using evaluation and research to increase the evidence of programs and practices that may be more feasible to implement in the field, right? We really want to know about the ones that are going to work for the field. And so that's an important part of our practice here. Next slide. So here's just an overview of the projects that were funded in 2016 and the map of where they were funded. All of the projects focused on adolescent populations, and I'm happy to talk more about this if there are questions later. Next slide. And so the example here, I think, of RPE implementation research is around health equity specifically. One of the areas is that we had the opportunity to reach historically underserved populations, including tribal and rural populations. Several of our recipients already had a focus in this area, but we had the opportunity to offer them some supplemental funding to really focus on the recruitment and retention of tribal or rural populations. And because of this funding, they were really able to tailor their efforts to be relevant to the projects and communities that they were serving. And that was a really important part of the implementation research that they were conducting through this funding. Next slide. These projects have just finished, and so they're beginning to disseminate their findings. There's a couple examples here of implementation related findings. For example, the top one is engagement of tribal individuals and the challenges and opportunities in trying to do that work within SV prevention. And then another one around contextual factors influencing implementation of SV programming in rural schools. And so it's helped, this work has helped to increase the representation of these groups, which is an important part of research on adaptation and implementation. Next slide. And here's just briefly where we funded our 2020 recipients. These are all projects that largely focus on creating protective environments and promoting social norms change. Next slide. And so we were able to build on the last supplement that I discussed here by providing the recipients a supplemental award to really focus their implementation efforts on health equity more broadly, to help build the evidence for program implementation in populations disproportionately affected by SV. And these are really a variety of populations, including sexual and gender minorities, different racial and ethnic groups, and youth with disabilities. And you can see on the slide the types of opportunities that they were given, or the types of things they could do with this funding. And we've learned from them recently that they've been able to help learn about the kinds of measures that are needed for different groups. They were able to create boards representing, the different populations for the specific projects, and really enhance the engagement of the different groups in the work. And so those projects have, or the supplement rather, has just ended and the projects are ongoing. So we'll learn more about what this sort of implementation research will have on their ultimate outcome evaluations as they continue. Next slide. And the second example I want to share with you is with dating matters, which Lindsey mentioned in the beginning. And I will walk through a little bit of how we've linked different areas of implementation science together here. Next slide. So as Lindsey said, Dating Matters is a CDC developed and evaluated comprehensive teen dating violence prevention strategy. It was designed for middle school students and their parents and communities, and it includes multiple coordinated prevention approaches that address risk and protective factors across the social ecology, which is what that graphic is showing on the right. We conducted a randomized controlled trial of Dating Matters and found that it reduced the risk for multiple outcomes in middle school, including teen dating violence, victimization and perpetration, related other forms of violence, including bullying, cyberbullying, and sexual violence, and then other associated behaviors like substance abuse and weapon carrying. Next slide. And so because we knew that Dating Matters was effective in middle school, we developed the toolkit to help it reach young people and communities across the country. So the toolkit itself is an example of implementation practice support, which Lindsey is going to talk about in a minute, but I'm going to highlight how we used implementation research to get there. It was designed with the primary goals of increasing adoption, ensuring quality implementation, and supporting maintenance, so that it included all the tools and materials that communities needed to carry out Dating Matters. Next slide. So as we started planning this approach to help bring Dating Matters to scale, we knew we needed to conduct some research on what was needed to do that. And so we considered several sources of data, including lessons learned from implementation and technical assistance challenges, data and feedback that we got from focus groups with youth and parents. We conducted interviews with implementers, and we also conducted implementation data itself during the demonstration project, or RCT. And so we put all of these sources of data together. And we came up with 4 main areas where we felt modifications to Dating Matters were needed to maximize its potential for adoption, implementation with fidelity, and sustainability. And the factors are listed here, which are training, technical assistance, and model flexibility. Next slide. And so on the back end of, so we did Dating Matters, we conducted all that research to develop the toolkit. We developed the toolkit, and then on the backside of that, we conducted some additional research and evaluation to see what was needed, how it's going, how people liked it. And so in 2021, we did that. And overall, you can see here that users felt that the toolkit contained the resources they needed, that they many of them thought they could implement the entire model, and many of them were really interested in doing so. But they also identified some perceived barriers, including stakeholder buy-in, resource constraints, including time and money, and COVID, because this was all done in the midst of the pandemic. Next slide. And so because of that research and evaluation, we were able to further adapt Dating Matters by creating some guidance for virtual implementation. It was, as I mentioned, developed in response to COVID, but it could be used anytime and really help to increase the model flexibility and accessibility, which is important given that huge model that, if you remember, I showed you earlier, it's a complicated program. And it also had the potential to address parent recruitment and retention concerns, which had come up in the trial as well. So I'm going to stop talking and turn this over to Lindsey, but I hope that I was able to, in the midst of all my technical challenges, give you sort of an overview of some of the research we do and how it's connected to other parts of the model that we'll continue to walk through.
Thanks, Lianne. So I'll just walk through the other three, I always call them buckets, but the 3 buckets of activities that we work on within the Division of Violence Prevention to share with you kind of why we think it's really important to think about these other pieces of implementation science to actually make sure all of the research is actually getting into the field, and the field is using evidence-informed programs, practices, and policies. So knowledge translation, some implementation science frameworks include knowledge translation, others have it sort of as, a complementary framework, but we thought it was really important to include in this model because getting the information out there is really the first step in making sure people are using the information. So knowledge translation is the process used to make science or practice-based knowledge understandable and create actionable products to facilitate adoption of programs, practices, and policies. And so the best example, I think, of our work around knowledge translation was the development of our 5 technical packages. And if you're not familiar with these and are interested in violence prevention, I highly recommend taking a look at them. They really were designed to pull together the best available evidence around how to prevent different types of violence. And I think what's really nice about the technical packages too is they sort of talk about the strategy and approach level, not just getting down to a specific program name or a specific practice, but really thinking about the goals of those programs and kind of highlighting what are the best strategies and approaches to implement comprehensively to address different types of violence. So these were all published between, I think, 2015 and 2017. We've just started updating one of them, so I'm guessing we'll continue to update others. But it really allowed us to think through what actually works in this area. And I think another thing I really like about them is they focus on upstream primary prevention all the way through tertiary or response, preventing future violence. So again, these are really our effort to take the research, the evidence in the field, and really package it in a way that it can help the folks in the field put something into practice. But when we were developing, when we developed the technical packages and we sort of sent them out into the world, we realized that it was just the first step really in helping people understand the what to do. And we wanted to think about how do we actually support practitioners in putting these technical package strategies into practice. So this is where I think something that we're talking more and more about at CDC and other agencies is implementation practice support. So it's setting up different structures and products that can proactively and purposefully engage, support users in actually putting these evidence-informed practices, programs, and policies into place in their own contexts and settings. So rather than just sort of saying, oh, we're going to publish, a paper or put out a toolkit, it's really looking at how we can more proactively support the field in implementing evidence-informed practices. So, I just wanted to say before I jumped into what our actual implementation guidance looked like, we had the opportunity to first start with our programs in our division. So we fund within the program division, or the Prevention, Practice, and Translation branch, we fund a total of 83 recipients, which really we wish we could fund many more, but that's how much funding we have currently for our programmatic funding. And we fund a variety of state and local health agencies, state coalitions, and other organizations. And our goal really is to help them develop, implement, and promote effective violence prevention practices. So you can see that by and large, our largest program is the Rape Prevention and Education Program, which goes to all of the states and some of the territories. But we have other programs that are also focused on preventing other types of violence. So within our branch, and specifically my team, we were sort of charged with looking at how do we help to both our recipients and practitioners in the field at large really think about how to implement the technical packages. And we are very fortunate that we have Veto Violence, which again, if you're interested in violence prevention, is a great resource, but it's our online resource for both tools, trainings, and information for the general public or for practitioners that want to know how to do violence prevention. So for example, the Dating Matters Toolkit that Lianne talked about is on this resource, is on Veto, and other information, including just general information about principles of prevention, but also some practice tools, which I'm going to talk about today. So one of the biggest resources that we developed to support the technical packages is called Violence Prevention in Practice. And as I mentioned, we realized pretty early on that telling folks where the evidence was not going far enough to help people actually look at how do they put that in place in their community. So we use violence prevention in practice to kind of take a very wide view of implementation, but to think about what does it take to actually get comprehensive violence prevention in place? How do folks go through planning, identifying the needs, building the appropriate partnerships, thinking about how policy fits, and then how do they select the most appropriate strategies and approaches for their specific setting? We also talked about adaptation, which I'm going to talk a lot about today, because I think, we're really trying to shift sort of that perspective that adapting an evidence-informed program is bad. So I'll talk a little bit about our approach to that. And then we also just wanted to focus on kind of how do you strengthen implementation? And last but not least, how do you make sure you're actually evaluating what's happening in your community so you can make improvements? So we focused on these 7 areas in our violence prevention in practice and sort of overlaid all of that with the technical packages. One of the things that I'm most excited about is that we really tried to develop violence prevention in practice to work across all 5 technical packages. And so in doing that, we really looked at what are some of those common strategies and approaches, those common elements around different types of violence prevention, so that we can highlight for communities who are working on violence prevention, how to select strategies and approaches that will actually potentially impact multiple forms of violence. So sorry, this is a little bit fuzzy, but so our violence prevention practice includes a number of different features. We knew that we wanted to make it a very interactive tool. So we have tip sheets so that if people want more information on a specific topic, we have tools like downloadable worksheets and checklists that people could use with their partners. We also wove in a lot of real life examples, so making sure that people could see themselves in the examples. And then linked out to all of the amazing resources that are all out there already. And then 2 of the pieces that were really important were to talk about each of the approaches in the technical package and how to actually implement them. And then one piece that we are currently trying to continually expand upon is also looking at how do you integrate health equity throughout all of this process. So as I mentioned, we were able to take all 5 of the technical packages and did a big, matrix to look at where were there common strategies and approaches across the 5 technical packages. And so the nice thing about this tool is you are able to search either by a specific violence type, or you can search by an overarching strategy, which will help you to see, again, what strategies and approaches are going to address multiple types of violence. So for each of the approach summaries, we created information about what the approach was, what the goals of the approach was. And then we also talked through key objectives, example outcomes, considerations when implementing the approach, who should be involved, which was a key piece, and then again, linking out to additional resources. And within the examples in the technical package, we had a fair number of different example programs, practices, and policies. So we also provided some information about implementing those specific programs, practices, and policies. And we started out, I think, with almost 79 different approaches across the 5 technical packages. And we're able, when looking across them, to get down to 40. So there are a fair number of these approach summaries in there that are really interesting, and at least give folks a start to thinking about how to implement in their community. So internally, we use both the technical packages and violence prevention and practice in our funding requirements. So we require the use of the technical package approaches and strategies for our recipients. We also guide our technical assistants around the structure of thinking about those 7 phases of comprehensive prevention. We use it for training new staff, so it's great when we're onboarding. And we also are very excited that we've been able to use it with a lot of other federal agencies. So as I mentioned, we only have funding for 83 recipients, but we have a lot of partners at other federal agencies who have a much wider reach. So this tool and the technical packages give us really that resource to help other agencies support their recipients as well. We also reached out to our partners to find out how they're using the technical packages and violence prevention and practice themselves. And some of the things that they shared were they use it to help with strategic planning, to strengthen partnerships, to train staff and subrecipients, and to summarize evidence and raise awareness for partners. I'll mention, as we've been looking at CDC at community and societal level strategies, it's really expanded the different types of partners that our recipients have. And so having this way to talk to their partners about why something like economic support is violence prevention has really helped them to have those conversations and to engage folks around, how do you get people involved that didn't necessarily think they were doing violence prevention. So I'll just share really quickly, this is kind of in our last data poll, we had over 951 separate efforts of all of our recipients. And you can see these are some of the most common strategies in the technical packages that we see folks using. So we do still have a fair number of recipients focusing on things like teaching skills, but you can see we have more and more recipients doing create protective environments and promoting social norms. And we hope to see this change more and more over time. So another thing I just wanted to mention, because I think we talk a lot about this to our recipients, but I think it's really important to talk to it about for folks that are doing research as well, is our essential elements framework. And some other frameworks call this core components. There's different terminology, but we use the term essential elements because we're really focused not just on the what you're doing, a specific activity, but sort of how you're doing it and who needs to be involved. So we developed this essential elements framework really to help practitioners in the field make strategic decisions about adaptation. So as I mentioned, moving away from that idea that you have to just pick it up exactly how it was in the research study and plop it in your community, but really thinking about what made it effective in that research setting and how can you adapt that to your community without changing those key or essential elements. So we focus a lot on the what, how, and who. So the what for a program, for example, is what you're teaching, the knowledge or skills. The how for a program is instructional methods or setting, the timing, how many sessions. And then for programs, the who is implementer characteristics. So the facilitator experience or engagement characteristics. When we think about community and societal level, who, what, and how, it gets a little more complicated, but I think can be even more valuable. So the community and societal level, what is really thinking about those key messages or design elements, the policy components that really need to be in place to make that effective. And the how is thinking about kind of any guiding principles or implementation methods or processes that need to be in place. And then the who tends to be sort of who's at the table, or what leaders or partners are there at the table. So right now we're really working on kind of looking at what this would look like for a place-based approach, something like greening. Is it the greening that's really that essential element, or is it that process of engaging the community, providing access? So really thinking about kind of breaking those community and societal level approaches down so that, again, you're fitting your own community while keeping those key pieces in place. So there's lots of reasons that, a community may need to adapt. Oftentimes it's to increase the relevance of materials. So for example, I'm working a lot with DoD in military settings, and a lot of the programs they're implementing were not developed for military settings, right? So they've got to increase the relevance of the materials, the language, to increase participant engagement, depending on who your audience is, to create or maintain relationships, so bringing certain partners to the table. And more often than not, we see to respond to limited time and resources. Unfortunately, oftentimes programs are developed in a setting that's very resource intensive. They've got all the things that they need to implement, but when we get in the field, that's often not the case. So there's also lots of different types of adaptation. So it may be who's in your program, who the partners are, what your setting is, what the specific focus is. And oftentimes there are existing programs or policies in place that may change the context that you're implementing in. So our hope with working with practitioners is first to help them understand how to use essential elements to assess if something even is a good fit for their needs. So thinking about what are those essential elements or those things that really need to be in place. And if they don't fit at all with your setting, then you're better off picking a different option, right? But oftentimes we see communities that pick something, they're implementing it, and they find after they've started implementing that it's not quite fitting. So essential elements can also help them to guide changes or adaptations to increase that fit. So, unfortunately for a lot of practitioners, there's a way to identify essential elements is similar again to how you might identify something like core components. So in an ideal world, we would have empirically tested the different components, elements, or adaptations. We fully understand the social behavior theory, the theory of change, and we have lots of implementation data, qualitative, quantitative, and there may even be usability testing. Unfortunately, that is not often the case. So what we've created is a practical approach to allow practitioners to really think through what information they do have about an approach to kind of infer or estimate the essential elements. So again, it's pulling whatever is out there and then thinking about their logic model or other documents, and then really reaching out and talking to others who have experience with the approach. So we both identify kind of the ideal way to estimate essential elements, and then we provide a practical approach. And we use just sort of a simple green red light to help people, again, to strategically think about whether or not an adaptation is going to change or impact the effectiveness of a strategy or approach. And really, this is all just to give folks a way to think about adaptation in a way that they're kind of thinking carefully about maintaining that balance between fidelity and flexibility, because we don't want them making so many changes that the program no longer resembles the evidence-informed program, but we also don't want them to make no changes and then it just fails in implementation. So we do have an online tool that we developed specifically to guide practitioners through this. And my goal, selfishly internal in the division, is also to use this with researchers to help them to start thinking about essential elements during implementation research phase as well. I'll just mention really quickly some other tools that we have developed just to kind of highlight all of the ways that we're trying to support implementation. So we have our general capacity assessment and planning tool on Vito. We also recently developed a tool to help think through evaluation and create an evaluation tool. And then we also compiled, and this started out of some of the rape prevention and education work, compiled a lot of different indicators that are either violence outcomes or risk and protective factors that are publicly available. Unfortunately, particularly in the area of violence prevention, there's just not a lot of surveillance or data out there. So we tried to really compile for folks what's already out there that you can use for planning and for understanding trends in your community. So sorry, I know I'm going quickly, but I want to leave lots of time for questions. The last area that we really want to emphasize, because I think this oftentimes gets forgotten and is such a critical part of implementation science, is program evaluation. And this really is a systematic method for collecting, analyzing, and using data to not only examine the effectiveness and efficiency of a program, but to really understand what's working, what's not working, and to continually improve it. And these program evaluations can give such valuable information to us about kind of how we might need to tweak the implementation practice support, where additional implementation research is needed, but it's really kind of tells us how is this working in the real world, right? So within our branch, we focus on sort of 3 levels of evaluation. We ask the recipients to all do their own evaluation of their programs. We also evaluate across recipients. And then most recently, we've been evaluating across all of our programs. And that lets us look at common themes and connections across different types of violence. We are able to look at how well our recipients are integrating health equity, and then just to really better understand our investments in violence prevention so that we can improve the way that we fund violence prevention in the future. So our last couple of slides, I'm just going to talk briefly about kind of how we're moving implementation science forward, and then share some of our recommendations internally so they may be helpful for you all as well. So as part of our work group, we really are focusing on kind of 5 key objectives: increasing understanding and common language around implementation science, as well as building capacity. And integrating implementation science, as Lianne said, into everything that we do, both filling the gaps, and then, as she mentioned, really making sure that we're closing the loop, right? That the folks that are doing implementation research are working closely with the folks that are doing implementation practice support so that there's that feedback loop in place. So some of the ways that I think we internally are looking towards the future and think that could be helpful for the field as a whole is, as I mentioned, just really increasing that collaboration between research and practice, breaking those silos down, making sure that we have not only the research to practice loop, but the practice to research loop. Also thinking about implementation science in all phases of prevention research. I know many implementation frameworks, they really look at doing implementation research last in the process, right? So we would argue that it's more important to think of that upfront rather than spending years and years understanding if something works and then factoring in the field. Thinking about incorporating something like essential elements or core components into implementation research. So moving away from studying a really rigid protocol that everything has to be in place, to really thinking about what are those key pieces that need to be in place and what can be customized or adapted to your community. And then another thing I think we're really struggling with, I'm not sure if you all are as well, but thinking about how do we fund implementation research that may use a different type of methodology that's getting us more information about what we need without setting up such strict methodologies, then we're not really able to get to the communities or to the practitioners that we need to get to. Also thinking about, as Lianne mentioned, we're trying to do more research and evaluation on practice-based approaches. So seeing what's really, catching on in the field and what is the evidence about that. We also are looking at ways to really integrate health equity and implementation science. And there's a lot of great articles that I'm happy to share about how to do this and why it's so important. And then the last two, I think, are just why we feel like our 4-bucket framework is so important, is tailoring knowledge translation and dissemination to practitioners, right? So I'm not very popular for saying we want to move away from peer-reviewed literature if we want to really support implementation, to moving towards what are practitioners actually using and reading. And then finally, thinking about what are the resources that support implementation practice, support our practice, so that we actually get things into the field. So that's all I had. And Lianne, I know I did those fast, so I don't know if I left anything off the last 2 slides.
No, I think that sounds great. I know we wanted to have time for questions too. So I feel like hopefully we didn't rush through it all too quickly and we have time to have some discussion.
Thank you both so much for a really outstanding presentation. So I know I have many questions and things I'd love to discuss, but I want to make sure we leave the floor open for all of the investigators that have joined us here. So feel free if you want to come off a video or to kind of put the hand motion up, we can make sure to answer all the questions. Okay, well, it's possible folks are still thinking about their questions. So I have a few follow-up questions. I'll start with one. Lindsey, you mentioned that a really important part of our science and our practice is making sure that we don't develop methodologies for research that create barriers to getting the kinds of data that would be useful. And that was a point that you made that I was really hoping you could flesh out a little bit more. How do you see that happening? And what are some recommendations for addressing that?
So I think we're even internally struggling with that, and Lianne may have some insight on this as well. And I, full disclaimer, I'm more on the practice side than the research side. But I think what we found is a challenge, particularly as we think about building the evidence for practice base, is that this idea that everything has to have a randomized controlled trial study before it's decided it's effective can cause a lot of challenges when we're looking at practice base, particularly when there's not the resources or kind of the ability to do something like an RCT. So I think we really have been kind of brainstorming how to do that. I think some of the ways we've gotten around it, and Lianne, this is really more your area, but is thinking more about funding rigorous program evaluations rather than RCT or research trials. But Lianne, you definitely are more of a research expert than me. So.
Yeah, no, I agree with everything you said, Lindsey, especially in that it is a challenge we're struggling with as well, because, RCTs are the gold standard of research, right? And so that is a difficult ask for communities to do in a lot of cases. They may not have the funding or the expertise or know who to partner with researchers to do that kind of work. And so I don't necessarily see it going away anytime soon. And I wouldn't argue that it should either in a lot of ways. But I think there are things that we're doing to try to help integrate implementation research, I think, more into bigger picture or bigger trials. And so, for example, I think the work that we're doing to get implementation research language into our funding announcements, I think helps to set the stage a little bit for that work to be incorporated in the work that we're funding anyway, so that we can learn about what is needed for communities to adapt or to make things feasible for different communities. That doesn't address the research being directly conducted in the communities themselves, but all the time. But I do think it helps us know what is needed. And so we could take that and then do better implementation over time. We're also thinking more about sort of feasibility and oh my goodness, feasibility and evaluability studies to think about, you know, what is going to be okay in the communities, what's acceptable to them. And so taking a step back, especially for practice, like homegrown sort of practice programs, so that we're able to get some information and to use that to build up to the bigger evidence, if that makes sense. So it is something we're struggling with. We do have some ideas, but I think we'd be open to hearing your ideas too about how we can do that better.
Thank you so much. What other questions do folks have? I want to be sure also, just for folks who are tuning in, to know that we'll have a quick poll to do before you leave today's session. I think we might have time for another question.
I have a question. I don't have any ideas for you, Dr. Estefan, about how to update that, but I am curious about, I think it was a really good point that a lot of people practicing are not looking at the peer-reviewed literature to inform practices. And there's kind of like, I'm just curious what other approaches you use that you find effective that aren't like publishing articles about these types of practices that you found are speaking to practitioners, because it does seem like such a challenge.
Yeah, I think what we've tried to really do is create things like knowledge translation briefs or our online tools. I know that's not always an option. Other things we've tried to do that's still peer reviewed, but is like look at what are the practice-based journals, right? So focusing on things where the practitioners might be more likely to read. Lianne, I don't know if you all have found other places that you disseminating at conferences. I'll say that's a big piece too, is going to practice-based conferences. But yeah, Lianne, I don't know if you all have found something as well.
I mean, those are a lot of the things we do as well. We often point folks to the tools that you have, Lindsey. So I think it's a loop in that way. I think really trying to find where practitioners are. And I think that is sometimes dependent on we do the research. So sometimes dependent on who we're working with, but really trying to figure out, the places where they go for information. I think practice-based conferences are one place. Other kinds of we work a lot with Prevent IPV, which is specifically for intimate partner violence. It's a practice-based sort of place where people can go for information. So we do a lot of translation from our research onto that website. And so places like that, national sort of centers for IAPV, for sexual violence, for other forms of violence, we partner a lot with those folks to help us disseminate our work in a way that will reach the audiences that, generally don't read the journal. So I think that's another way that has been really helpful for us.
Yeah, definitely the membership organizations can be a great way to get out the information.
I think we'll throw on the poll real quick before people leave, and people can still ask questions, but that'll give everyone a couple seconds to do a question.
Do you want me to launch the poll, Julie?
That'd be great. Yeah, thank you.
All right.
I will while you're doing that too. Oh, sorry, go ahead.
Go ahead.
Oh, I was just going to say, I'm just going to put this slide up, but I know it'll be available as well. So of just some additional resources that we have often kind of looked towards as well. And we are always collecting articles. So if there's something that comes up in future calls that you're curious about, just reach out and we can share anything that we've found.
And thank you both so much for taking some time today to share your work with us. We're just very grateful and appreciative for all of the knowledge that you've shared. I know you've given this group a lot to think about and a lot of resources to look at. I know a lot of folks are going to be downloading some technical packages and adaptation frameworks and really thinking about how this is going to advance their work, really in trying to set up research in injury control and prevention in a way that is going to speed the translation of research to practice and also better research what is happening in practice. So thank you both for being here. Very much appreciative. And we look forward to continuing the conversation, both within our group and with you in the future.
Thank you so much.
Yeah, thanks so much for having us.
Take care, everyone.
Bye.